Hi, everyone. Welcome to Conversations with Nicole. I'm Nicole Boone. Today, my guest is Dr. Craig Cohen of Inlet Physical Medicine out of Murrells Inlet, South Carolina. Dr. Cohen, good to see you again.
Good to see you, Nikki. Hope all is well with you in North Carolina.
All is going well. Life is good. And I'm so glad that you're back for another episode of Conversations with Nicole. Today, our topic is peptides. I'm very intrigued by this subject. And so, first of all, tell folks what peptides are.
Yeah, just to give a little bit of background information, I think all of us are looking for ways of trying to stay young and feel young. And I tell a lot of patients that if we're to be playing blackjack and you are playing against someone that has all face cards and you have a normal deck of cards, well, that person that has all the face cards, they're going to win most of the time because the cards are stacked against you. Well, as we get older, that's sort of what happens is the cards become stacked against us, so we start to gain weight and we start to not feel good and our joints hurt and we get dysfunction and our tissues break down. So peptides is one of those new aspect of regenerative medicine that can actually help repair and rejuvenate. So it's a really, really neat aspect of medicine. And basically what they are is chains of amino acids. And amino acids come from proteins. And they sequence these amino acids in a way to stimulate production of different bodily systems and functions. So there's different sequences that do different things, but what I like about it is they're naturally occurring amino acids, so they're safe and effective, and they're very tolerable, very few adverse effects. So that's what they are, chains of amino acids.
So looking good, feeling better is a big part of your practice with hormone therapy and the use of peptides and other, vitamins and supplements to help people feel better. Talk about the different kinds of peptides and how they are used for different individuals.
Right. So, what's great about peptides, now listen, they don't take the place of certain hormones, so thyroid and testosterone and estradiol. But what's nice about them is, for one thing, I guess the nice part and the bad part is you can really change and you can add these to other peptides, but they have to come from a compound pharmacy. You can't pick these up at, say, CVS or a vitamin shop, right? So the trick is for your listeners out there, make sure you go to somebody that is, knowledgeable about these and knows how they interact. But there's a few ones I'll talk about. There's so many, and they're designing more and more every day. The first one's ipamorelin, and ipamorelin is one that is used for muscle development and decreasing visceral body fat, repairing after injuries. It helps you sleep better. It helps burn fat, and it does that by optimizing the production of growth hormone. And I don't know if you've heard of growth hormone, but it's like the fountain of youth.
Right.
The only problem is growth hormone in itself, you really can't prescribe. And it also has some real potential risk factors. So doctors really can't utilize that.
Mm-hmm.
So ipamorelin helps your pituitary generate more naturally occurring growth hormone. So that's one.
Okay.
Now you can combine that with other ones that are similar to, increase the benefit associated with ipamorelin. The other one is a AOD peptide that we use for weight loss. And it's really specifically designed for that. Now, there's other benefits that come with it, but it helps stimulate fat burning. And it does it in a way that doesn't make you really hungry, and it doesn't change the insulin production. So you don't have to worry about a lot of side effects. So it's called AOD, and it comes in a troche. And what's super cool about this one is you can actually combine it with vitamin B12 and naltrexone. So you can take these peptides and you can throw other things in it, and it's all in one pill or one troche, and you can get all these different benefits you can add on to them. So it's an amazing thing. CJC is another peptide that we use, but one that I want to focus a little bit on is PT141, and that is really cool because it's a sexual peptide, and for men and women. And I tell a lot of my female patients, they really get the short end of the stick with this, because if you watch any TV show, there's at least one or two advertisements for men, and trying to improve, sexual dysfunction,
Sure.
but very little options for women. Women
Right.
are just left to suffer, right?
Right.
So this is one that's available that can really help with libido and help improve sexual dysfunction in women as well.
Well, that's awesome. So I know that you have a whole process of how you figure out what each person needs, and that's done through blood work, consultations, you take in lifestyle, diet. Is that correct?
Exactly. Yeah, there's no magic bullet for anything.
Right.
This just helps enhance the benefit of a healthy lifestyle, really. You can't substitute poor lifestyle choices like poor dietary choices and sedentary lifestyle. This isn't going to overcome that. But if you're that person that, is just trying to feel better, look better,
Yeah.
and you're really trying your best and living as healthy as you can live, and you're just, frustrated because you're stuck,
Yes.
this can make a huge difference for you because the results you're going to get from this can be outstanding. And you wouldn't be able to get that by itself with just diet and exercise.
And you've had a lot of success already with a lot of your patients, correct?
Oh my gosh, yeah. I mean, I use the ipamorelin myself, and I got to tell you, when they first came out, one of my colleagues was telling me about it, and he said, "Well, you're immediately going to get 20% stronger within a few weeks of using that." And I was at a time before my son was born, I had more time to work out in the gym, and he was right. I mean, I was at least 15 to 20% stronger, and most of that came from endurance.
Right.
But like I could wake up in the morning and you use that ipamorelin at night before bed because that's when most of your growth hormone is produced naturally.
Right.
And you wake up the next morning and you really can see where you're leaner. It's a pretty amazing thing. And so, the results are really, really great. And what I like about it more than anything is the safety profile.
Right.
They've been studied and they're very safe because they're using your body's natural, growth hormone production, and it's not artificial. It's not synthetic in that sense. So you're not throwing an artificial synthetic growth hormone. You're improving the receptor sites, which are the things on the cells that pull in the hormones and pull in the benefit for cellular metabolism.
I mean, it just really makes sense when you say it's what your body normally has, but enhancing it, because you lose a lot of things as we age, and that's what you're saying.
Right. And they say different studies, 14% reduction in growth hormone production each year after 30. Well, that becomes really substantial, and the growth hormone is part of what keeps us lean and feeling good. And why we hurt is the cartilage and tissue damage that occurs. So this helps repair that.
Awesome.
And it's just amazing. And as time goes on, there's going to be more and more, peptides that are available. I was reading about some today that are great for hair regrowth and,
Oh,
enhancing collagen. And that's what keeps our skin looking
yes.
healthy. And yeah, that's right.
Well,
So
you and I could just continue to talk about this topic and all of others for a lengthy amount of time. But as we wrap up, what's the bottom line? What do you really want my listeners and viewers to know about peptides and about your health in general?
yeah, I think the biggest thing to know is health is a multifaceted approach, and it boils down to the things you can control: diet,
Yep.
exercise, proper sleep,
That's
a
right.
good mental attitude. Those things go so far, but these are nice little things you can add on that are safe and effective that can really propel you to the next level. And you feel better, you look better, you function better, and you can do it in a way where it's safe and healthy.
Awesome. Well, listen, I hope you'll come back and be my guest again because we have plenty of topics that we can discuss from now until the end of time. But Dr. Craig Cohen with Inlet Physical Medicine out of Murrells Inlet, South Carolina, thank you so much for being my guest today.
Thank you, Nikki. God bless.
You too. And folks, that's going to do it for this edition of Conversations with Nicole. Until we see you again, we hope you have a great day.